Fibrocystic breast is a very common condition where your breast feels lumpy or rope-like. For some women, this condition can also cause a dull ache or tenderness, especially in the days leading up to menstruation, when hormonal shifts increase fluid retention and swelling. It's a completely benign condition, meaning it's not cancerous, and it affects more than half of women at some point in their lives. This condition happens when your breast tissue develops fluid-filled cysts and becomes more fibrous or dense. The word fibrous refers to the formation of thicker or denser connective tissue in the breast, while cystic refers to the cysts, which are small fluid-filled sacs that can develop within the breast tissue. Think of it as your breast tissue responding to your body's normal hormonal changes throughout your menstrual cycle. To better understand fibrocystic changes, let's first talk about breast anatomy. Your breasts are made up of glandular tissue, which produces milk, fibrous tissue, which gives support, and fatty tissue. They also contain a network of ducts that carry milk to the nipple. When hormonal changes occur, these tissues can become more dense or develop cysts, creating that lumpy, rope-like texture that's characteristic of fibrocystic changes. Types of fibrocystic changes. There are several different types of changes that can occur in fibrocystic breasts. Number 1. Cysts. Simple cysts are fluid-filled sacs that can develop in the breast tissue. These cysts can come and go with your menstrual cycle and might feel tender or painful. They can be as small as a pea or as large as a golf ball. Number 2. Fibrosis. Fibrosis refers to the development of excess fibrous tissue in the breasts. This tissue feels firm or rubber-like and can make your breasts feel denser. You might notice this especially in the outer areas of your breasts. Some women develop both cysts and fibrosis, which can make their breasts feel particularly lumpy and tender. The severity and combination of these changes can vary greatly from person to person. Causes of fibrocystic breast. The main driving cause behind fibrocystic changes is hormones, particularly estrogen and progesterone. These hormones fluctuate throughout your menstrual cycle, causing changes in your breast tissue. The tissue swells, becomes more dense, and sometimes develops cysts in response to these hormonal shifts. Several factors can influence the development of fibrocystic changes. Age plays a role. The condition is most common in women between 20 and 50 during their reproductive years. Family history might also be a factor, as some women seem to be more prone to developing these changes than others. Your lifestyle can also impact fibrocystic changes. Caffeine consumption has been linked to increased breast tenderness in some women. Additionally, certain medications, particularly hormone medications like birth control pills or hormone replacement therapy, can affect breast tissue. Symptoms of fibrocystic breast. The experience of fibrocystic breast changes can vary significantly from person to person. Most commonly, you'll notice that your breasts feel lumpy or rope-like when you touch them. These lumps might feel like small, round, movable masses under the skin, or they might feel more like a generally bumpy texture throughout your breast tissue. Many women experience breast pain or tenderness, which often changes with their menstrual cycle. The pain typically becomes more noticeable in the days leading up to your period and improves after your period ends. Some women describe it as a dull, heavy aching. The lumps and pain can affect one or both breasts and might be more noticeable in certain areas, particularly the outer and upper portions of the breasts. You might also notice that your breasts feel fuller or more swollen during certain times of the month. Other than that, some women also experience clear or slightly cloudy nipple discharge, which can happen when cysts press on milk ducts. This discharge typically isn't cause for concern unless it's bloody or comes from only one breast. It should be noted here that all these symptoms often become more noticeable during your reproductive years and might improve after menopause when hormonal fluctuations decrease. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of fibrocystic breast. The diagnostic process typically starts with a thorough physical examination. Your doctor will check your breasts for lumps and areas of thickening, and they'll ask about your symptoms and how they change with your menstrual cycle. Imaging tests like a mammogram or ultrasound are often used to confirm the diagnosis and rule out other conditions. A mammogram uses low-dose X-rays to capture images of the breast, allowing the doctor to detect any areas of abnormal density or calcifications. Mammograms are particularly useful in women over 40, as breast tissue tends to become less dense with age, making it easier to detect abnormalities. For younger women, an ultrasound might be preferred because it's more effective in distinguishing between solid masses and fluid-filled cysts in denser breast tissue. Sometimes, if a particular lump is concerning, your doctor might recommend a fine needle aspiration or biopsy. Fine needle aspiration involves using a thin needle to withdraw fluid from a cyst to confirm that it is benign. A biopsy, on the other hand, involves taking a small sample of breast tissue for examination under a microscope. This may be performed if the lump has any suspicious features. Treatment for fibrocystic breast. The good news is that fibrocystic breast changes often don't require specific treatment, especially if symptoms are mild. However, there are several ways to manage the condition and reduce discomfort. Number 1. Wearing a supportive bra. One of the most effective ways to manage symptoms is by wearing a well-fitting supportive bra that provides adequate support for the breasts. Look for bras that fit well and provide good support without being too tight. Some women find relief by wearing a sports bra or supportive bra, even while sleeping during times when their breasts are particularly tender. Number 2. Pain relievers. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage breast pain, particularly when taken just before the onset of menstruation. These medications work by reducing inflammation, which can alleviate the dull, aching pain associated with fibrocystic breast disease. Evening primrose oil supplements have also shown promise in reducing breast pain for some women, though you should always check with your doctor before starting any supplements. Number 3. Warm or cold compresses. Some women find relief using warm or cold compresses. A warm compress can help reduce pain and swelling, while some prefer the numbing effect of a cold compress. Try both to see which works better for you. Number 4. Lifestyle modifications. Lifestyle modifications can make a big difference here. Many women find relief by reducing their caffeine intake. This means cutting back not just on coffee, but also on tea, chocolate, and sodas containing caffeine. Some women also benefit from reducing salt intake, especially before their period, as this can help minimize fluid retention and breast swelling. You should also stay well hydrated and try to maintain a healthy weight, as excess body fat can increase estrogen levels and worsen symptoms. Number 5. Hormonal treatments. For more severe symptoms, your doctor might recommend hormonal treatments. Birth control pills can help regulate hormonal fluctuations and reduce symptoms. In some cases, prescription medications that block the effects of hormones on breast tissue might be recommended. Number 6. Fine needle aspiration. For cysts that become particularly large and uncomfortable, fine needle aspiration can provide quick relief by draining the fluid, reducing both the size of the cyst and the associated pain. This procedure is minimally invasive and can often be performed in a doctor's office. However, it should be noted that cysts can recur after some time. If this happens, you should tell your doctor. At the end, remember that fibrocystic breast changes are extremely common and not dangerous. However, they can make breast cancer screening more challenging, so it's important to stay current with recommended mammograms and other screening tests. Now, we want to hear from you. Have you ever experienced symptoms of fibrocystic breast disease? What lifestyle changes or remedies have helped you manage the discomfort? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.